So it is an olden day disease, and many people are vaccinated for measles in Australia, and so it basically isn't very common now in Australia at all. But what you find is there are small numbers of people who can't be vaccinated, who have missed vaccination in the past, and if they travel overseas and come in contact where measles still is around in places like Bali or Southeast Asia or some of the African countries, then what you find is if they contact measles over there and they're not immune to it, they can bring it back into Australia. It's uncommon to get the nasty side effects, but one of the things we ask when we're suspecting measles is the person unwell, because most people who get measles feel really miserable. Well, it's possible because measles is one of the most infectious diseases on the planet, but the more common way to get it is through airborne spread. So just being in a room where someone with measles was up to 30 minutes ago and breathing in the same air can actually give you measles. So it's a highly contagious disease. Well, measles is of a risk to anyone who's not vaccinated or had the disease in the past. So children under 1 year of age can't be vaccinated here in Australia, so certainly they're more at risk of the disease. But if you get measles in the older age groups, then you can get quite sick with it as well. And sometimes any of the people who get measles can get the complications, which include ear infections, chest infections, and even some nasty brain infections. That's rare, but it can happen, and that's why we're always concerned about anyone who gets measles. Absolutely not, no. So some people can get a reaction to the measles vaccine that looks a little bit like measles, but they're nowhere near as sick as if they actually had the disease, and they're not infectious like people with measles are. No, unfortunately measles is highly contagious, and it's the people who are not vaccinated who get the disease, who become infectious with it, who go on and spread it around to other people. If you're not sure if you've been vaccinated, you can check with your parents to see if they've got any of your old vaccine records, or you could talk with your doctor just in case that they have it. There's no danger to getting the vaccine again if you think you've been vaccinated but you're unsure and don't have any documentation. And in fact, what you find is that if you do that, it will help to increase your immunity and reduce your chance of getting sick, giving it to those more vulnerable people in the community.